Welcome to our video. I'm Kader Agerselik. The hair transplant procedure begins with local anesthesia is administered to ensure that the patient feels no pain or discomfort during the procedure. Next, donor hair extraction takes place using the FUE method, where individual hair follicles are extracted one by one from the donor area using a specialized tool. The hair follicles are carefully sorted and prepared for implantation. The next step of the procedure is called the DHI technique. Each hair follicle is gently dipped into the tip of the Choi Pen needle using tweezers. Next, a small puncture is created in the scalp, and at the same time the hair follicle is placed into this hole using the soft pressure technique. This process is repeated until all the hair follicles have been implanted into the recipient area. Using this technique, hair transplant surgeons can achieve natural-looking results that complement the patient's facial features.